Welcome to Health AI Insights, where we dive into the transformative world of artificial intelligence in healthcare. I'm Lily Body, your guide through this fascinating journey at the intersection of technology and medicine. Imagine a future where AI predicts illness before they strike, where your medical records are instantly accessible and securely stored, and where personalized treatment plans are crafted just for you. That future is happening now, and right here at the University of Texas at Austin, we are on the forefront of this revolution. Each week, we'll bring you in-depth interviews with leading experts, groundbreaking research, and real-world applications of AI in healthcare. Whether you're a tech enthusiast, a healthcare professional, or just curious about the future of medicine, this podcast is your go-to source for all things AI in health. So get ready to be inspired, informed, and amazed. This is Health AI Insights, where the future of healthcare is unfolding today. So today I'm here with James Tunnell. James, do you think you could introduce yourself and share a bit about your background in AI and healthcare?
Sure, thanks for having me. So I'm a professor here in biomedical engineering at UT. And I've been working for a long time in imaging. We do a lot of optical imaging using light techniques, kind of like microscopy. And the emergence of machine learning and now AI has just sort of increasingly been more and more common. And so we use it a lot to do image analysis and diagnostics and those types of things.
Kind of along those lines, can you provide a brief overview of your research, particularly your work in multimodal confocal microscopy, also known as MCM, and kind of explain what MCM is and its application to skincare surgery?
Sure. This is kind of a recent project, although it goes way back for us. And it's a bit of a mouthful. So it's multimodal confocal microscopy. So this is a special kind of microscope that allows you to kind of section tissue really thinly. So one thing that the physicians do whenever they're going to make a diagnosis of, say, skin cancer, is they take a piece of tissue and they slice it really thin, and then they look at it under a microscope. And we've been doing this for like 100 years. The challenge with it is you have to do all this processing. So you have to take the tissue, you have to fix it, meaning you have to make it really stiff so that you can cut it, and then you have to stain it to look at it. And what's been going on in pathology over the last 10 years or so is there's a lot of new types of imaging where you don't have to do all that processing, and you can create a microscope image that looks a lot like what a pathologist is used to looking at without having to do all the processing for it. So our project is to use these new imaging techniques to help speed up a particular type of surgery that's used to remove skin cancers and make that process easier for the patient and potentially more cost savings for the clinic that's doing it.
So how does AI play a role in that?
Yeah. So these new types of microscopes generate images that don't look like what a pathologist is normally used to looking at. They often aren't colored the same way, or they have a different resolution, and so they haven't been trained to see them in that way. So one of the big ways we're using AI is to recolor the images to make them look more like what they're used to looking at. So you can feed it this sort of new looking image. It might be like very fluorescent looking, or it might be grayscale, kind of like black and white, and then make it a color image that is called an H&E image, which they're used to looking at. So that's kind of the one way, is to kind of recolor images. The other way we're doing it is for diagnostics. So if you took an image, a big task that a pathologist is doing is making a diagnosis based on the image. And one thing that we can do is help direct the pathologist where to look, or even make the diagnosis on its own. So this is a way to kind of, for certain applications, to speed it up and have the diagnostic where you can't have them as easily right now.
Do you think the introduction of this technique will overtake the current Mohs surgery, or do you think that they'll stay separate?
I think it could help augment it. I don't think it would overtake it. I mean, it's a really great technique, this idea. So Mohs surgery is used to remove these non-melanoma skin cancers primarily that are on, high risk areas like the face. And you really want to remove the tumor and not anymore because you want to leave as much healthy tissue as possible. So it's an iterative process where the surgeon will cut out some tissue and then go look at it and make sure that they got the full tumor, but they didn't keep cutting into things that they didn't need to. And the big challenge, I guess, with this is that for the patient, it can be a long surgery. It can take hours, and the patients are just sort of sitting there waiting. And for the clinic side, the provider, they have to have a lot of training in order to do this surgery. They have to have a lab right next door. And so there's a lot of infrastructure that goes into kind of being able to do this type of surgery. And so we think that, introducing these kind of new imaging tools that are AI enhanced can shorten the time of the surgery and can reduce the sort of infrastructure that might be needed, like reduce the lab size and cut the cost of that and speed it up.
I think that would be such a good advancement because my grandfather always gets Mohs surgeries, and one of the biggest things he said is the procedure time. So knocking down that procedure time would definitely help. So you were kind of talking about having infrastructure in the lab, and in some areas that's not possible, especially rural areas. So do you think this will help rural areas have the access to better technology so they can provide this care?
Yeah, I think that could be a really interesting application for it. So the current surgical technique, has this big infrastructure that's needed for it. A lot of training goes into it, a lot of specialty. And so those that, living here in Austin, big city, we have lots of access to this. But if you go out not too far from here in the rural areas, they don't have clinics that can provide this type of surgery. So if you had low cost versions of these, that could be a system that could be put like in a general practitioner's office or even just a general dermatology office. I think you could imagine them using that to sort of tell them right away whether or not they took a big enough biopsy. And it could be a curative biopsy, and it could avoid some of the other treatments that they might get because they don't have access to Mohs.
What challenges do you see in deploying this technology?
I think there's a lot. Medical devices in general have a lot of barriers, and so one thing is, if you wanted to do a rural application like this, you really need to bring the cost down. So right now, I have PhD students in my lab that are building these types of microscopes, and we don't buy the cheapest things. Lasers can cost a lot of money. We use a lot of lasers here. So I think cost is a big one. We need to make sure that the cost structure works well. And then we also have to make sure that they work well enough. And that means like the diagnostic accuracy is high enough to get through regulations. The FDA has to approve this. So we need to be as good or better than the current pathologists and surgeons, and how they're reading these slides. And so we've got a high bar to meet in order to get this adopted. So I think those are a couple of the big things that we're dealing with.
Yes, I could see how those barriers could get in the way. How did you become interested in using MCM for skin cancer diagnosis and treatment? Is this commonly used today?
So it's not commonly used today. I've been involved for a couple of decades now in developing microscopy and spectroscopy tools. And so what's been happening kind of in this field is that these have been increasingly used for applications in like pathology. And so I just saw that, there was a real opportunity here to take out some of the kind of old ways we've been doing things in terms of imaging with kind of standard microscopes and generate images and data. We get lots of information from these new types of microscopy. And so we just saw an opportunity that these could be used in this area of skin cancer.
So, how did you all train this? How did you train the neural networks to identify structures like hair follicles and epidermis that often lead to false positives?
Yeah, so training is a really big issue. And for all of these new techniques, especially like deep learning and all the generative AI and stuff that you hear about out there, you need a lot of data. And this is probably another one of the big barriers that we have is getting enough data. So our typical experiment would be to build a microscope and then we get tissue from, in this case, like Dell Medical School. So human skin that's going to be discarded and we bring it back to the lab and image it. And, we can't build up a huge database of images for training like you might do for some of the other models you've heard about. So you want to train a model to recognize a car, you can go collect, 10,000 images of cars, and then it's going to do a pretty good job of learning what a car looks like. We usually deal with about 100 images, or 100 patient studies. So we're very limited in that regard. And it's mostly because it's hard to get clinical data like this. Patients, have to be willing to provide the tissues and the images that we want to use. So that's a big part of it. But that's how we run it. We collect data under institutionally approved protocols, and we use that data to train our models.
Yes, I know that data is such a problem in creating new clinical technologies. I've faced it in my lab. Do you have any idea how y'all are going to overcome this? Do you have any new ways of collecting data that y'all could implement?
I mean, there are a number of kind of like experimental ways to do it, and then there's some computational ways to do it. So experimentally, we've tried to choose applications where there's more availability of tissues and data. So the less harmful like our process is, the more likely we're going to get more data. So that's what we try to do. And so this case of non-melanoma skin cancer, they tend to sort of discard a fair amount of tissues, and so that makes it easy for us to get. So that's kind of like an experimental way to do it. Um, Computationally, you can get a lot of information from images if you augment them. So it's called augmentation, and you can sort of take one image that's maybe really large and then sample it at different places. And then you can also transform that image and rotate it, recolor it, do other types of augmentations to it to make it seem like it's a bigger data set. And that works well in a lot of cases, and that's a really common way to kind of increase the data size and increase the quality of your training.
So, looking forward, what are the next steps in your research? And are there areas of cancer treatment where you see similar optical techniques being applied?
Yeah, definitely. I mean, this idea that we're after is broadly looking at, trying to confirm tumor margins when you're removing a tumor. And so skin is one of the few places that this is done during surgery regularly. But there's a lot of other techniques where you would like to confirm that you've gotten the full tumor when you're doing it. So the case of like breast cancer and brain cancer and others. And so I think if we could prove it works here, where there's a nice gold standard where they're already doing kind of a similar thing, we could translate it into other places. And you can imagine, a small microscope or kind of like a scanner you could place in a surgery suite. And when they're removing a breast tumor, for example, they could scan that tissue that's been taken out and confirm that the tumor has been fully removed. So I think you could go out into other cancer types with it pretty easily.
Okay, and then one final question. What advice do you have for aspiring biomedical engineers, researchers, or healthcare professionals who want to make a meaningful impact in healthcare, particularly in the area of optical imaging and artificial intelligence?
Yeah, I mean, I think finding something you're really passionate about and interested in, and then going out and really trying to figure out what areas fit in. So, a place like the University of Texas has pretty much, every major kind of scientific discipline and piece of equipment, and so there's so many opportunities out there to kind of get involved and learn about different areas. Oftentimes I learned what I didn't like. So I would try all kinds of projects and areas. But by doing all these experiences and figuring out, what you don't like, you end up finding out what you do like. And once you find what you really enjoy, making an impact in that area is sort of much more straightforward.
Well, thank you so much for meeting with me, James. I appreciate your time.
Sure. Glad to be here. Thank you.
Thanks for tuning in to Health AI Insights. We hope you found today's episode enlightening. Stay connected with us for more deep dives into the world of AI and healthcare. Also, make sure to check out the UT Austin AI Health Lab, which also I will link below. Don't forget to subscribe, rate, and review us on your favorite podcast platform. Until next time, keep exploring the future of health and technology.